right, we are here today with Ramanand Patel, Cate Arima, special guests today. We are going to talk about yoga and the male pelvic floor with Ramanand, and I want Cate to introduce herself.
My name is Cate Arima, and I'm a nurse practitioner at Stanford Healthcare in the urology department.
And how did you happen to become here?
I was blessed to have had Ramanand as one of my patients. I had pre-oped him, or done his pre-op examination for his prostatectomy surgery. And that's how I came to be here. And then I also have a great interest in teaching my prostate cancer patients yoga for incontinence. And so that's why I'm here.
Wow, amazing. The universe works in interesting ways, huh? That we all came together. So Cate and I thought it would be really interesting to have the male perspective, because some of you know that I teach a lot about the pelvic floor for female bodies, but obviously I don't have the experience of being in a male body. So, Ramanand, thank you for talking to us today.
It's interesting to talk to ladies about it because they have a completely different pelvic floor.
Exactly. So we're hoping for some enlightenment, a little bit of enlightenment.
A little bit, because, Arima obviously has experience with a lot of females. I have not experienced with many men. This is my singular experience.
Right.
Nor am I a doctor or a nurse. So take my opinions with not a pinch of salt, but a lot of salt.
A lot of salt, okay. But you are an incredible, amazing, the best yoga teacher I have ever studied with. So you know a lot about yoga, and so bringing those two subjects together, I think will make for an interesting topic. So I wanted to ask you when you found out you had prostate cancer, and how did you find out?
I had gone to my doctor for just annual examination, and they took some blood test, and he called me back and said, we need to talk about this. Your PSA is very, very high. To the best of my memory, it was 24, 25. So I asked him, what is it supposed to be? He said, 0. So that seemed quite a lot. And I told him, I said, give me a few days, see what my yoga can do. So I started doing whatever, reading I could, and worked on some asana. Next time they took the test, it was 15. So I was encouraged that yoga would help it further. Unfortunately, it did not.
So can you tell us just a little bit of what you did? Like what was your approach to that did in fact lower it a little bit?
I did a lot of Uddiyana and the leg lifts in lying down position. That was the primary focus.
So working on your stability and engagement of your pelvic floor muscles?
I had no other symptom. Any symptom I read in the book that if you have prostate cancer, you're likely to have these symptoms. I had none of those symptoms. So in my own peculiar way, I thought the doctor is imagining this.
So I've known you for a long time, and I've hung out with you quite a bit, and you're someone who sometimes I'll say, how are you? And you'll say, oh, my liver feels a little sluggish today. And I know that you're not making that up, that you actually feel that, which is not the typical human being. So you didn't realize that you had this. Once you had been diagnosed, did you have any sense of it? Like when you were putting your mind more present in this area?
Yeah, I think it was more created by mind, just because I knew that there is something. The interesting also, I read later, and I believe Arima pointed this out to me, that she even asked the doctor that, the fellow is 80 years old, what are you doing having a surgery? Because apparently, all that it does, it might increase your lifespan a little. When you're 80 years old, they don't expect you to have significant effect. So surgery should not have been done at all from that perspective.
So tell us why you decided to do the surgery.
Because I wanted to get 100% well.
Okay. Okay, and it's not typical to have complications, but you are actually one of those. Do you know the percentage of people that have complications from having their prostate removed?
So typically, the side effects the side effects typically are urinary dysfunction and sexual dysfunction. The the risk factors of surgery itself typically are infection and bleeding. So the symptoms that you have with the hiccups and then the internal bleeding that had occur, that isn't something that we generally see right after a prostatectomy.
Do you have a percentage in your mind of how
I
rare it is?
I would say less than 10%. I mean, in the 9 years that I've been in urology, I haven't seen someone with that complication.
So we know you're special. So can you tell us a little bit about what happened after you had your prostate removed?
Yeah.
And tell us how you have, like, I know there's a couple different ways to have the prostate removed, correct?
Yeah, so I just wanted to back up a little bit first. So with prostate cancer, almost all patients don't have any symptoms, so it made sense that you didn't have any symptoms. And then the other thing is that when we talk to patients about the treatment for prostate cancer, there's generally 3 treatment options. One is called active surveillance, where we just watch the PSA every 6 months and do an MRI about every 18 months and then a biopsy every 3 years to see if there's a progression of the cancer. The second option is surgery, and then a third option typically is radiation, which usually is done in conjunction with hormone therapy as well. So I'm just curious, did the physician that you work with, did they present with you the different treatment options? Do you remember that?
They mentioned those and then basically told me, you decide what you want. And I don't have much experience on the basis of which I can decide what is appropriate.
Yeah.
But I did not want hormone therapy.
Mm-hmm.
So that by elimination, it ended up being a surgery.
Yes. Well, that makes perfect sense. And I remember when I was speaking to your surgeon, you're right, about doing surgery on a man who's almost 80 years old. He said to me, you were one of the healthiest patients he's ever had. And here you were at 79. And I remember even commenting to you the first time I met you, I said, yeah, you're not on any medication. And you eat healthy and you do yoga. No wonder doing surgery was a good option, or it seemed like a good option, because you were completely healthy. You didn't seem like a 79-year-old at all.
Yeah, in fact, after the surgery, next morning, doctor walked up to my bed and said, I felt like I was operating on a 50-year-old.
Exactly, yeah.
So I took that as a very good sign that I will walk out of this hospital any minute.
Okay, I have a lot of questions swirling around here because I think some of our listeners may find this video because they've been diagnosed with prostate cancer and they're looking for answers. So like you just said, I didn't really know when they gave me the options what was the best way forward, but you were adamant that you didn't want hormone therapy. Can you say why? Because
it would extend over a lot of time. Whereas surgery I felt was, it's done and it's over. Whereas hormone therapy would be continuous for at least a couple of years?
Generally, it's 18 months to 2 years, yeah.
Right. And then now I know that are most or all or some of the surgeries robotic, or is it really very...
at Stanford, we only do robotic.
Okay. And can you just say a little bit about the difference?
Yeah, so before robotic, there was what's called an open prostatectomy or open radical prostatectomy, which was basically a much larger incision, because of the larger incision, there was more of a risk of bleeding, more of a risk for infection. Typically, it would be a longer hospital stay. But then with the development of the robotic prostatectomy technique, the incisions are much smaller, and the hospital stay is generally only one night. So patients just tend to recover much faster with the robotic surgery.
And then in the United States, I know it's trending that way, but do you in your mind have a percentage of...
I don't have the percentage of how many patients are undergoing prostatectomies via robotic method versus the open method, but the standard of thinking is if you meet a surgeon and all he's ever done was open prostatectomies, you don't want him or her then to do a robotic surgery on you.
Right.
And vice versa. If your surgeon's been trained in robotic surgery, you don't want him to electively do an open prostatectomy surgery on you.
I have a doctor friend who is a psychiatrist, and when he heard that I had this problem, he said, go to Stanford, here's a guy who invented robotic surgery. I forget the name of the gentleman, but I saw him first. And then when I needed the procedure, he was out of town. So I ended up with Dr.
Yeah. So the director of robotic surgery at Stanford is Dr. Benjamin Chung, so that's probably who you saw initially. Yeah.
Can you now go through a little bit of your recovery? So you've gone to Stanford. You were there overnight?
Yes.
Okay, and then they sent you home the next day?
No, because any food I took, I kept throwing up. That's when they found out that there is some ulcer in the stomach that is causing this bleeding, this throwing up,
and that was something because of the surgery, correct? That wasn't there before.
Not that I knew.
Do you agree?
Yeah, so that's that's interesting because I wonder how we would have even known
Right.
that there was some sort of bleeding.
Something in the stomach.
Yeah.
And because I am a vegetarian, I don't eat spicy food and all that.
Right.
So I was very surprised that I had anything like that. Nor is there any family history of that kind of thing.
Okay, so they kept you, and then what happened?
Then I saw, what do you call it, gastroenteritis or some other doctor. They got funny names for all these doctors.
Yeah.
And that was Dr. Singh, who went in there with some scope, and she decided that you need to have certain drugs that would help to heal this. And the drugs worked in that, I was no longer bleeding like that. But I ended up much longer in the hospital.
Because
All these procedures that were being done.
I see. Okay.
And I didn't like the hospital stay at all. To the point where my mind clearly said, next time you need this surgery, die. It's not, the environment is, and the problem with the hospital from my point of view is that there are very few nurses and many, many more patients.
Mm-hmm.
So each time you ring a bell, they are not going to come running to you.
Right. Right.
So
Okay, so how long before you got to go home? About?
I think about 4 or 5 days.
Okay, and then tell us more, because I know there's more. So you came home after 4 or 5 days thinking now all the issues you'd dealt with were under control.
Yes.
But that wasn't true, was it?
No. Like Arima said, there are 2 functions you watch, and the sexual aspect completely failed. That didn't bother me. I asked my partner, it did not bother her also. So that part was fine. But the hiccups would not go away quite. Lasted a long, long, long time.
And that disrupted your eating and your sleeping and made you weak, yeah?
And my yoga practice, and made me weak.
Yeah.
I in the hospital I needed 4 or 5 blood transfusions. I kept telling my doctor, let me go home, and he said, just one, let's clear this up.
This is the initial, when you were in there initially, they gave you transfusions?
Yeah.
Wow, okay. All right, so how long after you were home, and you were home with the hiccups, I know that you ended up back in the hospital, but can you fill in the...
Yeah, my memory fails, but I think I ended up back in the hospital because of this hiccups that would not go away. And I looked at variety of things. Medical science offers nothing but hiccups. So they are guessing, let's do this, let's do that. I knew better things to do. But
it didn't work.
it didn't work.
And do either of you know why the hiccups, what caused the hiccups?
Yeah, so I clearly remember you guys contacting us about the hiccups, and I remember consulting with many of our physicians, and we had not seen that post-surgery. Ever.
Wow.
This was, as you had mentioned, this is a very new thing.
Yeah.
You got back into the hospital because your son strong-armed you, and then what happened? Do you want to tell? They found you were bleeding internally.
I think that's when I saw Dr. Singh.
Yeah, that's when they said that they were going to do a bunch of different procedures.
So what was bleeding? Your stomach?
Yeah,
Some ulcer in the stomach.
Okay. And the reason you were fainting is because of loss of blood? Is that what was going on?
That and general weakness also.
Right. Okay. And so how long were you in the hospital that time? About?
I think 4 days.
Huh?
I think 4 days.
And what did they do for treatment? Did they just...
Blood transfusion.
Blood transfusion and...
But how did they stop the actual bleeding?
Cauterized.
Cauterized.
Is cauterized.
Okay. Got it. Wow. That's quite a harrowing story. So with all that, I'm guessing you, like you just said, you wish you hadn't opted for surgery.
Yeah, I mean, hindsight is always...
of course. 2020 and beyond, yes. I'm so sorry you went through all that. So I'm sure that you have given this some thought. You are my teacher for a long time, and you mentioned karma at least once a class, if not 10. So I'm sure you've reflected on, why did I get prostate cancer? And have you thought about that, and what are your thoughts around it?
Some, what they call, karma that you don't understand, but it's something from past that is taking effect. Whatever happens because of a reason. Whether I know the reason or not, it's always there.
Do you feel, now that you've gone through that experience, that if people came to you for private instruction, you could help them more efficiently, or more,
No.
Why is that?
Because what I experience with my body is very different to what average person experiences. So if somebody comes to me, I would say something like, I will show you what I did. Okay? But that may not help you at all. Better thing to do is go first to the doctor. They understand your case much better than I do.
Mm-hmm.
So deal with that first. And in fact, ask the doctor, will yoga be good for me? And he's likely to say yes, although he knows nothing about yoga.
Actually, I'm curious, do you have some thoughts about that?
I think one of the things to remember is that, we actually all already have cancer cells within us.
Right.
All of us. And then it's just our immune system that, shuts off the cancer cells kind of thing. So, when I meet someone like Ramanand, and it's like, oh my goodness, how did he get cancer? Well, the thing is that because of his yoga practice and because of your healthy diet, and because of the way you live your life, this cancer didn't show up earlier in your life. It didn't show up until 79. So I just want people to know that even if you have a diagnosis of cancer, it's not that you're doomed. You could still do something about it that doesn't need to be surgery or...
Hence the surveillance option for prostate cancer, because it's usually so slow moving, correct?
Exactly. And the other thing about prostate cancer is over 80% of men die with prostate cancer, but not of
because
it.
of it. Right.
It's just so prevalent in men. So,
is there any research on, does prostate cancer weaken the immune system just because you have it and your body's trying to fight it?
I would say no, not necessarily, because we all have prostate cancer. I mean, not prostate cancer. We all have cancer cells in general, and it's never just one thing that caused that one cancer cell to just then explode in your body. It's not like, oh, I went on the roller coaster and I was stressed out and now I have cancer. It's never just one thing that leads to the cancer to start to spread in your body. But given that, I just want people to know. I just want people to know that in every moment, you always can make a difference in your life. Your medical history doesn't have to determine how you need to live your life. And Ramanand, you're a perfect example of that.
Yeah.
I don't know. I think it's true, but it might be because of surveillance. But prostate cancer, the numbers of people that have it in the United States are much higher than other countries.
And my own personal opinion is that it's because it's diet and lifestyle.
Okay, so you don't think it's just about like we keep better track of numbers here?
No.
Okay.
No.
So you think it's diet and lifestyle?
Absolutely.
Yeah. Can you say a little bit about that?
I think in U.S. culture, I think we live in a society that just wants fast, easy, convenient food. We greatly value productivity. So if it's just easier to eat fast food and work harder and be more stressed, then that's going to have an effect on your body, in my opinion, in this culture.
See, I read all that and I kept wondering, like, none of this applies to me. I'm not stressed out. I'm not overworking. My diet is good. Yeah. So it's an unusual
Stuff happens.
case.
Yeah. And the thing is that you could do everything right, and you're right, things will still happen. But the thing
Yeah,
the
like
thing
you
that
said
happens
earlier, all
doesn't
that happened in my case, it got delayed.
Right.
Exactly.
Right.
Exactly.
Otherwise, I would have had this much earlier.
Right.
Exactly.
Yeah.
Yeah. It would have affected, if this was detected, let's say when you were 50, because you, let's say, had a stressed out life and eat very poorly, then you might have had a lot of the same problems, same side effects that you did now. You would still have urinary issues or be sexual function issues. So I still promote and I still love that you led this healthy lifestyle and that it didn't come until later in life.
So we're talking very generalities about that, and I want to bring it a little bit more back to yoga. So for people with prostates, is there something particular in the yoga vocabulary that you would advise people to?
No, I would get off the subject of what I would do with prostate. Yoga knows nothing, even less than what medicine knows. But the side effect, particularly incontinence, that's something we can work
Okay, well, that was the next thing I wanted to talk about. But I wanted you to just maybe say something about, I asked you, this was many years ago, but I was teaching a group of prostate cancer survivors. And two things that really struck me were, one, they most of the class had that habit of pulling their stomach in and up on the inhalation. Like I was trying to just teach them correct breathing, and they were arguing with me about it. They were like, "You're telling me this is wrong?" And I'm like, "Yeah." And then I would also say most of those people that had that reverse breathing habit were very posterior tilted in their in their posture. And I mentioned that to you, and you said, interesting. That may have, contributed a little bit to that. Not that it caused it at all, but you were just saying, like, if it was present, that could have hastened it. Do you still feel that way?
Yeah, but part of the trouble is knowledge. Normal breathing, when somebody is relaxing, is belly breathing.
Yes.
Okay? But in pranayama, I specifically taught not to do that.
Right, but we're talking about people just walking around and they're breathing not well.
Yeah.
Yeah.
Except, if they read about or think of doing pranayama, average person should not start pranayama on their own.
Completely agree. But the average person would be better off if they had a more healthy breathing pattern.
Yes.
Yeah. So with that said, because you're not giving me what I want, I'm going to say it and you can say yes or no. But would it be helpful to teach more beginner students that might be prone to prostate cancer, like an older male population, to make sure that they're breathing well and that they do things that open their pelvis and things like that. Wouldn't that be?
Yes.
Yeah.
Like in my case, what Arima already mentioned, that it got delayed before I had symptoms
Right.
of it. That could happen with most people if they do proper yoga,
Right.
live a healthy lifestyle.
Right.
It can postpone it
Right.
and may not even get it.
Right. Okay, so then moving on to the most, after you recovered from all of the complications, what you were left with was a bit of incontinence. And so I know you've told me that it's pretty much resolved, but you worked very diligently on it. Can you talk a little bit about that?
Yeah, every so often I would get a note from the doctor saying, fill out this feedback. And each time I said, everything else is fine, I'm eating fine, there's no other problem, I'm sleeping fine. But incontinence doesn't quite go away. I didn't get any response from the doctor about that, but I started to work on yoga postures to help towards that.
Can you tell us what they were?
I don't think there is any name I can give you, but maybe we can do some yoga.
Okay. Can you generalize about the postures? Were you focusing more on feet and legs to pelvis, or were you
Generally,
doing
it was more pelvic opening.
standing or sitting or lying down?
Both, all three.
Okay. More
even
pelvic
in,
opening.
Even in whatever inversions I could do.
Okay.
Not actually doing what we call Uddiyana.
Not doing it.
Not doing it. Not the full Uddiyana.
Okay.
But the beginning of Uddiyana.
So a mini Uddiyana? What do you mean? Like a not so strong one? Is that what you're saying?
No, I would approach it this way. When you lie down and you lift the leg up, this comes up.
Right.
Okay, for most people. To show how to take that down, area just above the pubis, and widen it. The subject that came at, I briefly discussed with Cate Arima, I believe that, what is taught in the name of Kegel exercise,
Right.
to me is a complete nonsense.
Yeah. Would you
In fact,
elaborate, please?
yeah, reading Dr. Kegel's original writing, he
Mhm.
never talked of narrow movement like that.
He was also talking to people with vaginas, so
Yeah,
there's that.
but that attempt has to be wider, not narrow. It's not like a tubular thing.
Before I ask you to say more, I would love you to explain a little bit of after the surgery, like where the scar tissue is and what that might inhibit.
Yeah. So when the prostate is surgically removed, first of all, the prostate is located at the bottom of the bladder and the top of the urethra. So when the prostate surgically removed, they sew the bottom of the bladder to the top of the urethra. And then at the bottom of the bladder are your pelvic floor muscles. So it makes sense that there will be some pelvic floor weakness because that's the surgical site.
But when you say weakness meaning some scar tissue.
So scar tissue, so
some
there can
gripping would
absolutely,
that happen?
absolutely. I would say decreased functionality. So the ability to relax lengthen, relax the pelvic floor open, contract, shorten the pelvic floor muscles.
Is compromised.
Exactly is compromised.
Mm-hmm.
Yeah.
So, given that, I have worked with a couple of prostate cancer survivors, and none of their doctors have suggested pelvic floor physical therapy. What
That
do you think
blows
about
my
that?
mind.
I know.
Because I recommend pelvic floor physical therapy to every single one of my
I clearly haven't worked with your patients.
And
But-
the interesting
yeah.
thing is that I actually met with one of the pelvic floor physical therapists that I refer to, and she said with the referrals that go to her group, in the referral she wants you to place that they're going to either have a prostatectomy or they're post-prostatectomy because they automatically get placed at the top of the list of who to be seen first. That is actually their priority.
Okay, that's great
Which
to
is
know
different.
at Stanford, but you know,
Yeah.
our listeners might not have access to Stanford.
Yeah.
But that said, do you know the pelvic floor PT, the protocol, is it a lot of internal
Yeah, so
manipulation.
it's absolutely internal
Yeah.
First, it's an external assessment.
Right.
And then there's an internal assessment.
Yeah.
And then there's usually a biofeedback where they insert a probe so that you can see how well you can contract your pelvic floor muscles, and then how well you can relax them.
Right.
And so just learning how to do those
Right.
then teaches you to have a better functionality
Right.
of your pelvic floor.
Thank you. Just
You're
wanted a little shout out for the pelvic floor
Yeah.
PTs.
Yeah.
Okay, but yoga is, I think,
Okay, I think we can
Great.
go to yoga room
okay.
and let me show you what I did that I think helped me most.
Okay, we will do that, and we cannot do it all with the magic of editing. So let me just ask one of our last questions, and then we'll cut to that. This is Kate's question. Did you want to ask this last question?
Which was the question that I was
That one I thought was really a good question to end
Oh
with.
yes. Okay. So yeah, I was wondering, how did your diagnosis and treatment of the prostate cancer change how you view the world and how you chose to live your life?
Wow, big question.
I think my tendency was to get back to my life as it was before all this diagnosis and everything. Psychologically, spiritually, that's where I wanted to get back. So, although it obviously, when the surgery happened, I had to stop some of these practices, particularly physical yoga. I got back to it slowly, as quickly as I could.
How did it change? How did knowing you have prostate cancer and going through all of these procedures and treatments and complications, how does that change your view of life, if any?
Nothing, it became a blessing.
Life or the challenge.
No, the whole challenge of it. The idea that the body has cancer, I do not have cancer. That became much clearer. Okay. Had I not got the cancer, that would not have been as clear. But the body goes through certain rhythms
Yeah.
for whatever reason. Nothing happens to me.
Yeah.
Now that is something is not possible to teach an average person unless they are interested in the subject of who am I.
Yeah.
So for me, although I would not wish cancer on anybody, once you have it, it forces you to look at who are you. Okay. The body will die, so what?
Wow, a lot of us are attached to it.
For good reason.
So it sounds like it solidified for you even more that you are not just your body, that you are much more than
Much more than body.
your body.
Yeah.
And I think that's really good for people to hear, because when people, I know some of my patients, when they are diagnosed with cancer, they think all they are is this cancer.
Yeah.
Right.
They forget about everything else in their life. They're just thinking, I'm only this cancer.
Right. And then looking at videos of very, very famous people like Ramanand Maharshi and so on, they had very poor physical health towards the end.
Right.
And yet, they function extremely well.
And your teacher, Swami Dayananda, you said
Yeah.
the same thing. Yeah. Good question.
Thank you.
Thank you so much for your time
Thank
today.
you, Ramanand.
Kate, thank you so much for
Thank you,
coming.
Leslie.
Yeah, it was really
Thank
great.
you.
And we hope this is helpful to those of you that might be facing this challenge.
If you lie down like this and you are asked to lift the legs up, not all the way into your chest, but just up, so the thigh is perpendicular to the floor. What most people do when they have a weakness is they arch their back. And the idea is not to make the lumbar flat, but don't arch unnecessarily like that. So to lift the feet up, if you are not to arch the back, what muscles would you use? Most people end up with, I would use my pelvic floor, my abdominal muscles. So that's where I would differ, that you don't need the abdominal muscles really to lift the legs up. Okay. What you need is your pelvic floor. And to develop that pelvic floor, the first thing that you want to see is put your hands on the pubis, my fingers like this. Slowly move the hands towards the head until you are just off the bony tip of the pubis. Okay? You are now on the soft surface just above the pubic symphysis. And now try to lift the legs up. And what you find is under your fingers, this area hardens and it lifts up. Hardening is good, it should be firm, but it should not come up. You should learn to spread it. So the first part that I would ask people to learn is lift the floor up, don't worry about this coming up, but now hold the feet in this position and learn to keep it very firm, but drop it to the floor, towards the back, and widen it. Then once you are able to do that, even with one leg up, if you are able to do that, then learn to bring the feet up and down slowly, maintaining that. Then if you can do that, you take a little height under the pelvis. Okay. This is to increase the height of the pelvis. Don't necessarily lift the floating ribs up. If they automatically come up towards the ceiling, that's fine. But don't try to arch. Okay? So without arching now, same thing here. I lift my feet up, my feet down. Okay? Nothing here comes up. Then I'm happy with that. I add a little more support to this. I would add a height and repeat the same thing basically. I'm going towards what is called Setu Bandha. Okay? But in that, the chest is not lifted towards the ceiling, it's lifted towards my head. Like this. Okay? And I go up and down with my feet again. And currently, this is as far as I go with this. I'm not using my abdominal strength. So a little higher than the arrangement I had with the blocks.
But also the curve of that prop is helpful.
Yeah.
Right. To keep your pelvis in a better position.
So now if I'm teaching that to Andrea, I would say, come and lie down here, Andrea. And two things I would emphasize. One is to hold that area firm by yourself is difficult, so you put this weight on it. Hold the weight. Okay. Now see that the weight doesn't come up as you lift the feet up. Or if it comes up, hold the feet up, try to drop the weight towards the floor.
And that helps with the spreading of that area you were talking about,
Yes.
right?
So it's not narrow anymore, you widen it much more. Okay. And you can, 5 pounds is maximum I would use for her, but you can increase the weight or decrease it. Okay. All right, let's take rid of that. The other thing to learn is to use the really bottom part of the pelvic floor. Can you give me the roll behind?
This one?
This one will be fine. Thank you. Okay. Now, in order to not engage your abdominal muscles, people in beginning when they lift the feet up, they will tighten the belly. To avoid that, I would teach with something like this. Okay. Where I push this very, very firmly. She's lying down on a sticky mat, so she can't slide up. I push this up and they say, now lift the feet up. And there is no abdominal muscle required at all. The foot basically flies up.
Right, but that's because you're imitating a very strong pelvic floor, but the lower transverse abdominis is still firm.
Yes.
Yes. Okay,
But you should be able to do that by yourself.
Right.
And the steps of learning that are, Andrea, lie down this way, this side. So being on a sticky mat, you try and get as close to the wall as you can. Then, without sliding away, take this, lift your pelvis up, put this in here, and come down on it. So it's like I'm pressing you with my foot, same kind of thing. Okay? And the feet should again fly up very easily.
That's so nice.
In lifting the feet up, you're using belly. Don't use this at all here.
So I find, so what you just showed, I love this, but when she's getting into it, it could force her to become a little more posterior because the mat, so she should go back to neutral, correct?
If she can.
Yeah. Yeah, and then that should help her engage more properly.
Now obviously you can have great variety of this. If there are belts here, you can hold the belt.
Well, sometimes I have people hold the roll like that, but then
Roll also.
they're tensing their shoulders. So
You can hold the sticky mat also. Basically get in as close a contact with this as you can. Then learn to how to use the feet without any tightening here. Nothing, zero. And compare it to when you don't have this support, you immediately try to engage the abdominal muscles. And people call that core strength. It is not core strength. Core strength is the pelvic floor strength.
But what I've read, and Kate, correct me if I'm wrong, is that soon as the pelvic floor engages, the transverse abdominis engages, that they're synergistically...
They co-contract.
Yeah.
Yeah.
So I think you're talking about how it's contracting.
I'll use my teacher's answer.
Okay.
No. Because if I say yes, you tend to use it even more.
Okay, got it.
I mean, you were saying that you are affirming the transverse abdominis, like the area right above the pubic bone.
Above the pubic bone.
So.
I think you're refining the engagement. I would say it that way.
Okay.
I don't know, but I want Ramanand to say yes. It's still engaging, but it's engaging in a much more sophisticated way.
I mean, when you tell people don't engage your abdominals
Right.
at all, that doesn't make sense. But maybe when you say engage just the transverse abdominis, they're going to think that doesn't make sense. I'm going to engage my whole abdominal muscles.
Okay, here is what I would say to people who have a little more knowledge about physiology. I want no pressure of this on the stomach at all.
Yeah.
On the organ of the stomach.
On the organ
Yes.
of the stomach.
Right.
But unfortunately, in our culture, stomach is also sometimes used as this whole area of the
That's
front.
Well, I like that what you did with the weights, because if you notice if the weight's moving up or down, then you know you're not engaging correctly.
Correctly.
So I thought that was good.
Yeah.
That sounds good.
And you can't use a weight like, round weight like that.
Yeah.
It's got to be something narrower. No bigger than this diameter.
Yeah.
And I'm spreading at this abdominal level or in the pelvic floor?
As lower down as you can. So
And-
hold it there. Make sure this weight doesn't go up. But take this sense, keep widening at the bottom of the pelvic area. But that's already more than 10 minutes that I said.
Right.